Now, you're going to make the choice if you want an epidural or you don't want an epidural when you're in labor, but what other choices did you get to make about the epidural in labor? Today, we're going to talk about some choices that you can think about towards your upcoming birth. The crazy thing with an epidural is there are some very yes or no questions about it because we've got to make sure that it's safe, but then there are a lot of things that you can tailor to make it right for you that we don't always talk about. So I'm excited that you guys are here. And I got to say, when I was a baby nurse, I didn't know a lot of these different things. It's something that I kind of grew into as I was a nurse for 20 years in labor and delivery. So your nurse may not offer these things. It doesn't mean that she's being mean or, she just may not know. But there are things that you can do, and your anesthesiologist should be on board with helping you with those things. Now, there are so many choices in labor and delivery, and this is just a very small part of them. Grab my free birth preferences series. I think you guys are going to really enjoy it. It goes through some of the most common choices that you'll make and includes a video where I help you kind of go through those choices and make the best choices for you, because it's not like this answer is right and this answer is wrong. What we want is things that are right for you. So check that out. Okay, the biggest one is that you can tailor the epidural. So after we put in the epidural, and honestly, you don't get a lot of choice about putting in the epidural, the anesthesiologist really dictates that to make sure that they have their best chance of getting it in the right position safely. But once it is in, we put a bag of fluid into something that looks like an IV pump, and it slowly pumps in the fluid to the spot where the epidural tubing is at. By the way, we don't leave a needle in your back when we put in the epidural. We put in tubing just like we do with the IV, so no needle is left in your back. Now, that medication can be increased to make you more numb, and it can be decreased to make you less numb. For me as a nurse, I was a big fan of getting you pretty darn numb for a couple hours after we put it in, because that gave you the opportunity to get a solid nap in, and you deserve that. Usually when you're asking for an epidural, you're tired, you've been going at this for a long time, and getting some rest in is going to fill up that gas tank so that you can make it through pushing to the delivery of your baby. But after that nap is done, sometimes I would ask patients if they wanted to feel or move a little bit more, and you can actually decrease your epidural to do that. Now, let's say you wake up from your nap and you're feeling way more than you want to feel. By the way, I have a whole video on what to do if your epidural doesn't work, because that could be the culprit, although sometimes we just need to increase that rate so you feel even less. Everybody is different, and honestly, in the hospital, everybody gets put at a 12 or a 14 or a 10. They just have a standard that they start everyone at, and far too often we leave everybody at that 12, even though everybody reacts really differently to the medications that we put in your epidural. So if you are feeling too much, ask them to increase it, or at least come check it. Your anesthesiologist should come in the room and see if it's even functioning, see if they can give you more meds and see how they can fix that. Or if you're too numb, you can't move the way that you want to, ask them to decrease it. And the good news is if they decrease it and you're feeling too much, we can again increase it a little bit. It is variable. We just get to punch in whatever number we want. So make sure that you are tailoring the epidural to what you want. And if some of you are sitting out there thinking, I thought the epidural was going to take away absolutely every ounce of pain, it can, but that's not really the goal of the epidural. The goal is to take away about 80% of the pain. And I actually have a whole video about how much it will hurt with the epidural. So check that video out as well. The next one is the catheter. So after you get an epidural put in, if it's an hour or more before you have your baby, most often they're wanting to put a catheter in, and that is a tube that goes up into your bladder and drains out the urine. So your bladder, which is right here, doesn't get in the way of the baby coming down. If you were to have a full bladder, it actually prevents the baby from coming into the birth canal, and we want to prevent that if at all possible. And fun fact, after delivery, if your bladder gets too full, it can also be problematic from your uterus crunching back down so that you don't bleed. Fun facts about your bladder. However, there are a couple different kinds of catheters that we can use. There's one that goes in, we fill up a little balloon in your bladder, and it stays there until we take it out. That's called a Foley catheter. There's also something that we called a red robin. It's just a red catheter where it goes up, drains out the urine, and then comes right back out. Now, A lot of you are thinking that one of those seems better than the other, and usually hospital policy has dictated which one a patient should have, but I'm here to tell you that you actually can choose. When I've looked over a lot of different studies, I've read a lot of them, there really is no significant difference between trauma to the area or increased infections with one or the other. Every now and then I do see people online saying that one is better than the other, but I'm really here to tell you that whichever one you think is going to be better is better for you. For some people, they do not want something staying in that hole. And so the one that goes in and out is going to be the best option for you. And for some people, getting it put in is absolutely like their worst nightmare because we do have to spread your legs open and put the Foley catheter in. There's a lack of privacy during that time frame. So they want that one and done. The Foley stays in and then it comes out when it's time. And again, each of those are what is right for them. So think about which you think you would like and then talk with your nurse to see what's right for them. I guess there are probably hospitals that don't stock one or the other, but I think if one really appeals to you, talk with your nurse about it and they can probably make it happen.
I did want to say every once in a while, I get people who say they didn't need a catheter because they could use a bedpan. And I'm here to tell you that sometimes some people retain the ability to let their urine go and to get up on a bedpan, but the majority of patients do not. So I always recommend that people are ready to get a catheter. And I got to say, a lot of people absolutely love the catheter because it is uninterrupted sleep. You don't feel like you need to pee, and that's a big win for a lot of people. So I just wanted to put that out there.
And the last thing I want to talk about is your position with the epidural. Too many people get the epidural and they think, I'm just going to curl up in the fetal position and let my uterus bring this baby down. And I'm here to tell you that movement is still just as important during labor as it was if you didn't have an epidural, which, by the way, is very important. So make sure that you're changing sides every half an hour. Make sure that you're helping your nurse for you to move as much as you can, which is why I'm a big fan of decreasing the epidural till you can move a little bit as long as it's not too much pain for you. And a big pro tip with this one is to get your partner involved. As a nurse, it's really hard for us to position you in the bed without a buddy in the room, which a lot of times means that we have to go get a nurse at the nurse's station. And sometimes there is not a big supply of nurses at the nurse's station to help us. So if your partner, because this is not brain surgery, it's very easy, can help us position you, it can really help you get better care and get moved more frequently because your partner is willing to be involved. And I'm here to tell you that dads really love it when we give them a job to do. They feel helpless and kind of useless sitting in the corner. So when we say, hey, it's going to be your job to help me move her every time I come in the room or every half an hour, they're like, sweet, I've got a job. That's something that I can do. They're really excited to do it. Now, if you have a partner that you think would love to be more involved in preparing for birth, but you're not really sure how to do it, I actually have a birth class that's created for couples. I'm going to link it down below, but I think preparing together is going to be so smart and you're going to be really glad that you did it. Now, here's 3 things that you get to choose with your epidural, but I am telling you that there are so many lies about the epidural. I have a whole video about the lies of the epidural that I'm linked to up above. Remember, you get to tailor things with your epidural. Even if they don't mention it in the hospital, you can always bring it up. Thanks for joining us here at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.